If we want to know, what is hepatitis?
First of all, before I start, I would like to commend you for the statistics you gave. It was really, really apt. You've done quite like half of my job. Now, the thing is this. Hepatitis, that word itself, hepatitis, simply means inflammation of the liver. And to put that in layman terms, it just means that the liver is sick. Right? We can go further than that, but because it's not a medical audience, I'll leave it at that. Hepatitis in itself has a lot of things that can cause it, but our focus is going to be the viral causes of hepatitis. So the viruses that can cause it, there are quite a number of them, but you have A, you have B, you have C, you have D, and you have E. Okay. In all of this, B and C tends to be most prevalent in Africa, more so in Nigeria, and they tend to run a chronic course, that can cause deleterious effects on the liver. Every July 28th, in the 365 days, the WHO has dedicated July 28th to the discussion of hepatitis, viral hepatitis. Why is this? Just like you stated, you said 255, but I need to just throw more light at that. In 2025, it's approaching 300 million. 300 million persons globally living with hepatitis B.
300 million persons?
Globally, living with hepatitis. Viral hepatitis, that is. Now, the world population is what? Approximately 6 billion. So we're talking about 5% of the entire world population having hepatitis B and C and other hepatitis. Now let's cone it down to Africa. Africa takes the burden of hepatitis, represents a large percentage of patients that have hepatitis globally. What about Nigeria? In Nigeria, we have an estimated 17 million persons living with hepatitis B and C. Now, this takes into account centers or hospitals that can keep their data. We cannot tell you what is happening in the villages or the rural region. So, in other words, it might be more. Now, how do people get this hepatitis B? More often than not, some of our patients, they tend to do blame games in terms of how it came. Why is that? Because they know that, some persons know that it is contracted through sexual intercourse. It can be contracted through situations like going to salons, using sharps indiscriminately. You go to salon, somebody who has hepatitis have used the salon tools and is used on you. That can also be another contraction point. Let me just throw this in. For comparison, HIV can stay outside the human host for just about a couple of hours. Hepatitis B, for instance, can stay up to 7 days. You see those things where people talk about, oh, we went to the salon, I'm the first person of the day, so it has been sterilized. It doesn't happen with hepatitis B. So by the time we're talking about the prevention, we'll probably throw more light on that. So, indiscriminate sharp. Then, contact with somebody who have the virus, maybe you have a broken skin, the person, body fluids and all of that, you can also contract hepatitis B and C. So just when you are looking at all of this, you start telling yourself, oh, it's somebody brought it in, like I said, the blame game. But there is a subset of people who are innocent and pick up the virus. Who are these? These are children who pick it via what we call vertical transmission. Their mother have hepatitis B and it is passed on to them. So a lot of our young patients, people like 15, 18, 20 years, when you go back to their history, you find that it is a vertical transmission of hepatitis B.
Okay, yes. I hear someone one time said, okay, this child has hepatitis B. Don't make use of the same cup the person is making use of. I don't know, can that also be transmitted onto another person?
Yeah, this is some of the things that we are trying to clarify. Nature is not entirely wicked. So, for instance, breastfeeding cannot transmit the virus.
Okay.
Just because somebody used the cup cannot transmit the virus. In fact, just kissing somebody cannot transmit the virus. So yes, it is safe to use tools, feeding tools that somebody who has the virus has used. It's quite safe.
Okay. Okay, so now we've talked about the meaning of hepatitis and the different types of hepatitis that we have, and also how it's been transmitted. Now, when we're talking about hepatitis, is there a way that one can actually know, okay, I'm coming down with hepatitis, and what are these symptoms?
Very good. Largely, it is a quiet virus. It's a quiet illness. So a lot of persons are passive carriers and they don't know. And they can stay for like 10 years or more like that. But in the acute phase, when it becomes active, everything we used to know about malaria fever can also double up for hepatitis B and C. They can start having just body pains, malaise. They can start having fever. They can start throwing up. Then it can progress to what is called jaundice. Their eyes will be yellow. So at that jaundice stage is where a number of persons get really worried and say, okay, let's go to the hospital. Go to the hospital, yes. Then it can progress from there. So when it starts affecting the liver properly, they can now start having leg swelling, they can start having abdominal swelling. If you go to the rural areas, when these things are happening, somebody is looking at them and say, oh, you've matched poison. Oh, not quite. It might just be the liver affectation via hepatitis B that we're talking about. So basically, that is it.
Okay.
You know, fever should not just be thrown away. Fever is something that could be a pointer to it. Yeah.
Okay. Okay, now, let's look at the theme. Let's break it down.
Yeah.
Now, what's the focus of WHO in all of this?
Yeah. I mean, this is something that WHO carries out yearly. But what we are talking about is that we want the grassroots to understand. Before I came here, I did a health talk for some certain number of, large number of patients, because we want you to have the nitty-gritty, the tiny details of the things. Just as we are saying it, it might scare you, but at the end of the day, we have good news. You know, so basically, we just want you to know all the tiny details of hepatitis B, how it can be contracted, and how you can pull yourself out should anybody have it. Yeah.
Okay, nice one.
Yeah.
Okay, so we'll go on a short break, and when we'll come back, we'll dive more on the things that patients that are already in it should take note of.
Okay.
And for those persons that, you know, prevention.
Yeah.
Prevention. Okay, so let's go on a short break. We'll be right back.
All right, thank you.
All right, it's Head 11 on your dialing station with yours sincerely, Oluije Oyikokai. And we're looking at hepatitis, yes, World Hepatitis Day, and the theme, let's break it down. Okay, now, WHO has come out with the theme, let's break it down. Let's look at vaccination. Can this also help in, you know, curbing the menace, yes, of, you know, hepatitis? Because to me, I see it as a silent killer. This is something that when it begins, you don't even know. You have a broken skin and someone that has it, and you don't even know the person that actually has it. Now you come in contact with that person, and all of a sudden you have hepatitis B. And the notion we have, oh, it's gotten through sex and all of that. So what about the children? Actually, you know, from the northern parts, you get to get someone, maybe like a help, and you go for testing, because you always hear someone say, oh, make sure you go test that child for hepatitis B, and you find a child coming down with hepatitis B. So you're wondering, as little as this girl, she has hepatitis B already. So you want to know, vaccination, what's the role of vaccination in all of these? And how do these little ones, how do they come about getting hepatitis B?
Okay, so before we get to vaccination, the first point of action is get tested. Because now I just say that the symptoms are non-specific, right? So the first thing is that we encourage everybody to get tested. If you do get tested, like today now in UBTH, we did a lot of free testing for patients. If you get tested, if it is negative, that's one side. Those are the people that qualifies for vaccination, right? Albeit adults. Should the patient get tested and the person is positive, those goes into the group and the pool of people who would attempt to treat. Now let's face the vaccination side.
Now you said attempt to treat.
Yes.
Why is there an attempt to treat, and why is it not? Oh, that's the people that we will be treating.
Yeah, because there are two viruses I'm lumping here. We have hepatitis B and hepatitis C. Now for the C, you can give them medications. The medication period spans for about 3 months, right?
And they'll be
Albeit
fine.
it's expensive. A month's dose is about, the last time I checked, is about 270,000.
It's okay.
But basically, it's you can handle that. But for the hepatitis B, we put them on the medications, but we don't have a time frame where we tell them that the medication is going to stop. So some persons may take it for 5 years, some person may take it for 10 years, some people may take it for life. That's why I carefully use that word, an attempt to treat. But what we know is that by the time they get to the medications point, it slows down whatever is there. So that's for that. Now for the vaccination. The vaccination before now vaccination plays a pivotal role. In fact, I cannot overemphasize the importance of vaccination. From children, from childbirth, there's already vaccination program for hepatitis B. For children whose mother is hepatitis B negative. Now for children or babies, let me use the word babies, whose mom are hepatitis B positive, there's also a way we handle them such that they don't come down with hepatitis B, and vaccination also help in that regard. What about the adults? Now for adults, yes, if you are negative, you go for the vaccines. There are 3 doses of vaccines. There are 3 doses of vaccine. So the way it is taken is you start on day 1, like today, day 0. Now, a month after the first dose, you take the second one. Then 6 months after that, you take the third one. So sometimes, most people will tell you, yes, I know that I started, but I can't tell you whether I finished. You know, it is important to finish that. Why is this schedule like that? Why do you have to take break? Because the vaccine in itself is sensitizing your body against the virus. So we inject a bit of it, and we give your body an opportunity to build immunity. You do that, give it a bit to build an immunity for the third dose comes in. So vaccination, that's the good news I was talking about. Imagine having a disease that is as terrible as this, and you can have vaccinations to prevent it. So what are we talking about? But this vaccination, please, let me just clarify, is for the hepatitis B. The hepatitis C
it's just drugs.
Is not, there's no vaccination for that.
Okay, now quickly, because time is not our friend.
Okay, that's fine.
Let's look at lifestyle practice.
Okay.
Are there lifestyle practice that one going to you know, warrant all of this? And if there are, what can one do to prevent, you know, such lifestyles? So basically, there are some group of persons that are more prone to this disease. Now, the first group of people are, you know, people who have indiscriminate sexual intercourse without protection. So obviously, they are at risk, and, you know, of course, those patients can easily contract it. Then secondly, people who use sharps indiscriminately, like I just said, whether in the form of intravenous drug abusers, people who get tattoos from sterilized places, people who uses, you know, sharps, especially ladies, especially our ladies, who would go to salons and all of that and not have their own kids. So those things can also, those practices. Then there's a concept called MSM. You know, that's for patients who indulge in practices of same sex. They are also noticed to have higher risk. So basically, those are lifestyle that can easily tilt patients into, or people rather, into contracting the viruses. All right, so prevention.
Prevention, as soon as you know the cause, prevention becomes easy. So the first thing we preach, you must avoid indiscriminate sex. Like we've been talking for the last 20, 30 years, protect yourself. If you want to do what you want to do, get a condom that should offer some form of protection. Then you should have your saloon kits. You should have your saloon kit. We have them so cheaply. So you should have your saloon kit, especially when you have children. Imagine going to the salon, an innocent child having to pick up the virus from that. Then also another major point of prevention is getting tested. That is like the central dogma of it.
Okay, so how often can one say, okay, let me go, go for testing?
There's no really caveats to that. It depends on your lifestyle. There's really no really caveat to that. If you've done that, maybe the next 3 months you can check again. Maybe like twice in a year should suffice. Actually, twice in a year should suffice.
Okay.
Yeah.
So what's government's responsibility in all of this? And yes, WHO has said, let's break it down.
Yeah.
So in breaking it down, you as a professional, a practitioner in your own field, so what have you been able to do to sensitize the public and all of this in your own little way? Yeah.
So we have forums where we organize and go for outreach to different locations and do sensitizations. Now, if you know anything about UBTH, is a major pool of patients. We also use our general practitioners clinic to do a lot of sensitization. We just did one today, and of course reaching out. Then talking about the government, one thing government can actually help people and doctors with is the vaccination, the vaccines. Provision of the vaccine is actually something that would really, really, really help.
Okay.
Yeah.
All right, so we're looking at affordable care.
Yeah.
Free and affordable care. Can one actually get, free care of, the hepatitis B patients?
Yeah. Now, before now, the vaccines was under WHO funding. So as at that time, it was free. It's not free now, but it's just a token patient has to pay. But this is what I say. Is there any price you pay for something that will protect you for life? So that's for the vaccination. Then when it comes to the care, the medications free, for now, we don't have programs that will make it free, but we actually hope that governments would come on board. And we've been talking to some government agencies, and they are actually making a lot of good promises. We just hope that they make good on their promise.
Okay, so looking at the thing, because I like to, focus more on the thing. Now, what can one say we are to take home? Yeah. So as far as the theme is concerned. Yeah.
With respect to the theme, the point is this: number one, take action by getting tested. Should anybody be positive, it is not a death sentence. If you are negative, you can go for vaccination. If the patient is positive, you take your medication, and that is it. But should you not do this, hepatitis can be a very disastrous disease. It can predominate, it can predispose patients having liver cancer. And by the time it gets to that point, it's just crossing the Rubicon, and there's no return from there. Okay. So that's what we try to prevent.
Okay. All right. So let's get your advice to, to parents out there. And I'm looking at also, you've talked to the government already. Now NGOs too. So let's get our word out on them.
My advice to parents would be that we need to supervise and watch our kids, our wards. Sometimes they play with a lot of sharps and everything. So if you have your child coming to tell you that, mommy, I just got a cold, daddy, I just got a cold, you might just want to just check at that point and just make sure that your child is okay. I know the economy might be tough, but it's also important that parents need to get their barbing kits for their children and all of that. Then for NGOs and government, we actually are hoping for massive collaboration, because I noticed something just now when I was dealing with patients. When we started talking about, okay, you're going to pay a token for vaccination, that dissuaded a lot of persons. So if we can have vaccinations that are free, if we can have the medications cut in half, not necessarily free, just cut in half, we will be able to, massively reduce the stress of the disease.
Okay, so do you feel hepatitis can be, eliminated?
Oh yes. Oh yes. That's the WHO global team. So sometime in 2016, WHO did a projection where they said in the next 30 years, they want 100% elimination of hepatitis B and C, and that's what we are working towards. Knowledge is one of the things that we use to eliminate it.
Okay, to pass out the information.
Exactly, exactly.
All right, thank you so much, Dr. Ato Daniel, for
Thank you.
taking out your time to be with us today to talk about hepatitis. Now, the key thing is prevention.
Yes, please.
We need to prevent all this to also get, you know, kits for our children. Your child is going to the barbing salon, get his clipper.
True.
Your child is going to make her hair, you know, get her comb and all this. So it's very, very essential. And go for testing also. All right, so we will be seeing again next week by His grace. Till then, do have yourself a blessed day and always remain healthy. Bye for now.
Thank you.